So we just wanted to share some information about the IPHCC to start. So the Indigenous Primary Healthcare Council is an Ontario-wide organization dedicated to advocating for and designing Indigenous-led healthcare systems. Our mission revolves around creating healthier Indigenous communities through healthcare models built on Indigenous principles, values, and knowledge systems. So IPHCC is not on the front lines, but we do everything in our power to ensure that our members' work on the front lines is as well funded and well resourced as possible. Our mission is to use Indigenous solutions to transform Indigenous health outcomes and decolonize health systems. So how do we do this and what does this mean in practice? So firstly, we empower and amplify your voices at the right tables to advocate for funding and resources. Second, we build relationships and partner with Indigenous communities, mainstream health organizations, and all levels of government so that our messaging is being heard and culturally safe care is a priority at the organizational and system levels. Third, we gather and share data to tell our story so that any gaps that exist can be addressed. And finally, through all of this, we equip our members with the tools, training, and networks they need to provide the highest quality care they can. So this is a map of IPHCC's members. We are proud to call 22 of these incredible organizations our members, and they're spread all across Ontario. So our members serve an estimated 80,000 First Nation, Inuit, and Métis individuals, families, and communities. 50% of our sites have Inuit clients, 88% have Métis clients, and 100% of them have First Nations clients. So our members provide services across the province. 94% of our members serve on territory and First Nations, 69% serve rural areas, 88% serve urban areas, and 38% serve remote areas. So this is our model. A holistic model for Indigenous health and well-being integrates traditional knowledge and Western medicine and healthcare services, recognizing the interconnections between physical, mental, emotional, and spiritual aspects of health. So in Ontario, the IPHCC has developed a holistic and health and well-being model that emphasizes the importance of traditional Indigenous knowledge and practices, as well as collaboration with Western healthcare providers. By adopting a holistic approach, healthcare services can better address the unique health needs of Indigenous communities in a culturally safe and effective manner. So bridging the gap. So we try to use a two-eyed seeing approach to data. We understand the value of data and the people to whom it most affects. So we try to incorporate Western as well as Indigenous values in our data frameworks and systems. We look at data from both traditional and Western lens, and we can also look at data from a local governance and provincial oversight approach. So I'll be passing it to Kristen, who will be sharing more about the work that IPHCC has been doing in developing a data governance framework and what today's session is all about.
Thank you so much, Prab. I noticed that while you were speaking, Rachel has entered the room. So I wonder if Rachel, sorry to put you on the spot as you're just getting here, but if you would mind just sharing a bit of information about yourself and saying hello to everybody at the webinar today.
Yeah, no worries. Sorry, I was having some technical difficulties getting on. So hi, everyone. My name is Rachel Raddick. I'm one of the Indigenous Cultural Safety Coordinators here at the IPHCC. So I'm really happy to be here on the webinar today and to be here and be present. So miigwech.
Thanks very much, Rachel. So again, everybody, my name is Kristen. I'm going to be walking you through a few slides to set some context into today's session. Prab, can we move to the first slide, please, of this section? This section, rather. Thank you. So everybody, Indigenous culture has historically shared a lot of sacred information from generation to generation by virtue of storytelling. Good data governance practices are vital for the IPHCC and for the sector at large because they set the stage for how we collectively work to tell our stories in a respectful and safe way. So data governance structures need to be in place to ensure that the data, the stories, the knowledge, and the insights that we create, collect, hold, handle, and share help us to appropriately interpret and share those stories. It also enables us to reliably advocate for change and properly identify actions that cultivate positive health outcomes for Indigenous people and communities in Ontario. So it's very important to make sure that we understand that data governance is really a fundamental concept in terms of being able to use data and tell stories. Indigenous data governance also ensures that the individual as well as the collective rights of First Nations, Inuit, and Métis persons who receive care at our member sites are respected. And we do that by establishing a cohesive set of principles, objectives, roles, and responsibilities to govern data. So what does this mean for the IPHCC? So data governance ensures that these elements are upheld for the collective information generated by the sector, as well as the data that we manage and hold through our day-to-day activities. So therefore, the data governance framework consists of the components listed on this slide. So we have our vision and principles, governance structure, accountability mechanisms, policies and procedures, both related to data governance as well as privacy and security, legal instruments, some of you may know these as data sharing agreements, as well as considerations for research and ethics. So in order to effectively support IPHCC members, we recognize that a lot of different players at different levels of the healthcare system need to work together effectively to ensure appropriate data governance. So here we outline the 3 pillars to governance of Indigenous data. Given the complexity of Indigenous data, we know that it's very fragmented. The data and storage systems are often quite removed. There's a lot of gaps in coverage. Ensuring successful implementation of our data governance framework is going to require a lot of wide-scale consultations with parties at the federal, provincial, as well as the individual member sites who we serve. Each of them bear really distinct responsibilities in order to enact it, and we're very much cognizant of that and bearing it in mind as we move forward. So with recognition of stories as really valuable data, and as it continues to represent and honor culture and Indigenous data sovereignty, the IPHCC has developed a framework that we refer to as the Stories of Strength. It's a set of values and principles that we have identified through a series of extensive consultation with IPHCC members. So the guiding principles that you see here on this slide outline expectations for decision-making and behaviors relevant to IPHCC members and their communities that have been applied and that we're bearing in mind as we continue to evolve and implement this framework. So here on this slide, we see that safety, trust, ownership, relationship centrism, impact awareness, excellence, strength building, optimism, framing, supportiveness, truthfulness, respectfulness, expression upholding, narrator focused, gift valuing, traditionally based, and honor are all principles that we are bearing as central to our work in the data governance implementation. So our work plan for this year consists of 3 main pillars. Today, we're meeting to talk about what's listed on this slide in blue. So development of a governance indicator framework. This is to support organizations with implementing and evaluating and monitoring their own internal data governance initiatives. We're also working this year on developing policy and procedure templates that organizations can customize and enact within their individual organizations to ensure appropriate Indigenous data governance. And then the third pillar is development of data sharing agreement templates. So I talked about how this is sort of a major component of the data governance framework at large. And the purpose of this work is to create those agreements that outline accountabilities of parties with respect to sharing data owned by Indigenous people and communities. And again, those can be customized according to the individual needs of organizations. We are hoping that we can learn from you about measures that might be appropriate for inclusion in our data governance indicator framework. Again, that framework will consist of a set of indicators that you can use in your organization to implement, to monitor, and to evaluate Indigenous data governance. A quick note, though, that we wanted to bring to your attention. Although we're meeting to talk about these indicators today, I want to make it really, really clear. There's absolutely no data collection or reporting strategy being planned. There's no scorecards or anything like that. Our purpose today is to identify indicators that can be used to implement and evaluate Indigenous data governance initiatives that are relevant to you, from where you sit in the health system, from where you provide care, with how you interact with Indigenous communities. And we want that to be reflective of the spectrum of data governance maturity. I'm going to talk a little bit more about that later, but we recognize that implementing Indigenous data governance is a journey, and we want to be able to meet people where they're at in their stage of the journey. So again, I'll talk about that later. We're of course talking about indicators today at a very high level. What some of you might notice is that specifications for those indicators won't be provided. And I know many of us wear data hats, and indicator specifications are very, very important because they really tell us what that indicator is measuring and sort of technically what we're looking at. However, the purpose of today's session in particular is to identify high-level indicators that can measure a number of key concepts that we're going to share with you. Those concepts are, of course, related to the data governance framework itself. But once we identify these high-level indicators, we have a lot of engagement planned over the next year to be able to sort of outline in the details of those indicators, to refine the specifications and create sort of, again, that short list that we can provide to people as a tool for data governance implementation within their organization. So in particular, after today's session, we will share a summary of what was discussed and the findings and the indicators that we were able to highlight. In the fall, some of you may be aware, there is a planned data gathering that the IPHCC is discussing right now. We are hoping to come back and chat with the attendees of that session about the indicator specifications. And then again in the winter to share what we have done over the past few months, and again invite feedback into how those indicators should look, what they should be measuring, and any other input that is relevant to this work. So I just wanted to, again, let you know that there will be lots of opportunities for you to provide that detailed feedback on the indicator specifications. Our measurement framework for data sovereignty, rather, is based on what we refer to as 4P methodology. So Prob at the beginning of the webinar talked about the two-eyed seeing approach for data, sort of incorporating the traditional sort of approaches with a Western lens as well. And what you're seeing on this slide on the right-hand side is that Western approach. So policies and processes, rather, they are indicator domains that speak to things like the existence of policies, the existence of processes. But as we've been chatting with and engaging with our membership, we have found that these are indicators that may be quick to just be checked off, sort of like, well, we're doing it and we're doing great, but there definitely needs to be a bit of a counterbalancing of these measures with more traditional approaches. And that's where the two domains on the left, the partnerships and the personal experiences, come in. So I'll go through and read our explanations of each of the indicators. So starting on the top right-hand side, policy indicators speak to the policies or strategies in place to ensure accountable governance of Indigenous data. Processes similarly, are used to ensure that policies are being implemented as designed. On the top left-hand corner, the partnerships indicator domain measures the fact that extensive engagement is required with communities to ensure that their interests are prioritized. Partnership indicators are needed to evaluate the satisfaction of parties and making sure that the right relationships are in place with the communities who own data to ensure effective governance of that data. And then at the bottom left-hand side, The personal experiences domain speaks to the lived experiences of Indigenous people and provides a 360-degree view of whether policies, processes, and partnerships are supporting their intended outcomes. And that's really important because although, it might not be the case, a given organization in theory could have all the policies, all the right processes in place, all the right relationship agreements signed, but maybe Indigenous people who are receiving care within that organization still aren't feeling safe. So we have to make sure that with these personal experience indicators, that the intent of the policies, of the partnership agreements, of the processes that we're putting into place is actually coming to fruition, that the purpose of it, which is ensuring the safety of Indigenous people and Indigenous data, is there as well. So another important consideration that we're taking into account is that implementing appropriate Indigenous data governance doesn't happen overnight. So I talked about this before, that continuum of data governance implementation. IPHCC members and partners are at different levels of maturity with respect to implementation, and we want to be able to meet them where they are and provide them with tools that further that data governance journey. So when you start to think about cultural safety as both a process and an outcome, we see Indigenous cultural safety as a really important foundation for enabling appropriate data governance. So as you can imagine, organizations who have already started the thinking of, journeying towards respectful engagement, of recognizing and addressing power imbalances within the system, they've already started the wheels turning to be able to enact data governance. They're again thinking in this way. They are starting to talk about policy and examining how things are affecting different groups of people. So they're very well positioned, again, to enact data governance. And we wanted to be very mindful of that fact that it's an important stepping stone and an important first step in particular to ensuring appropriate Indigenous data governance. Which specifically reviews a spectrum of data governance maturity. And this is relevant to our conversations today because as you're discussing indicators, we want to make sure that the indicators that are being chosen address all these different phases that organizations can be in with respect to implementing data governance within their organizations. So there's 4 phases here. A phase 1 organization has good awareness of data governance and of cultural safety. So they recognize the importance of cultural safety. They might be working to develop and implement some policies and procedures that are aimed at addressing health equity considerations that Indigenous people face. Key characteristics of this type of organization, they might display a commitment to engaging with communities represented by their clients to understand strengths and needs. And then they might also be creating a cultural safety strategy in collaboration with Indigenous clients and communities. In the second phase, we see this as a very active planning phase. So here, a given organization has made a commitment to providing culturally safe care for Indigenous persons. They're starting to engage in specific discussions with Indigenous communities about appropriate governance of their data. And some characteristics of phase 2 organizations are that they might have developed a cultural safety strategy. They're working on developing relationships with communities and perhaps some template agreements as well. They're having discussions regarding data governance and sovereignty. And they're working on creating Indigenous governance, data governance structures, processes, and policies. A phase 3 organization is more focused on the implementation of what the thought and the planning that happened in phase 2. So here, an organization is actively ensuring ongoing cultural safety, and they're equipped to ensure appropriate governance of Indigenous data as well. Key characteristics of a phase 3 organization are that data sharing agreements might be in place with partners as well as Indigenous communities, and data governance policies and processes are fully implemented. Beyond phase 3, we see, of course, organizations who have not only implemented Indigenous data governance initiatives within their organizations, but now are working to optimize the processes and the policies in place. So here, they fully implemented, they're continuously improving, and they're ensuring culturally safe care and sound Indigenous data governance practices. Some key characteristics of a phase 4 organization are that policies and processes are fully implemented with respect to data governance. Organizations actively monitor and refine their cultural safety and data governance practices. And there's consistent and meaningful engagement with Indigenous communities to adapt and evolve those practices. So again, a given organization can fall anywhere on this spectrum, and we want to make sure that we're selecting indicators that are relevant to each. So we're about to start some discussions in breakout rooms, but I wanted to circle back to a point I made earlier about the indicators that we're choosing today being tied to some key measurement concepts and making sure that we're able to capture those through the measures. So we talked about the 4 Ps and the 2-eyed seeing approach and the 4 different domains. So you're going to be separated into 4 different breakout rooms. Each of them will represent either the policy, the process, the partnership, or the personal experience indicator domains. I wanted to share with the group before you head into your individual rooms what the key measurement concepts are for each of the 4 Ps. So for policy, we want to ensure that cultural safety policies and strategies are in place to ensure that Indigenous persons feel respected and safe while they're receiving care. We also want to ensure that data governance policies are in place to guide the collection, analysis, interpretation, release of Indigenous data and research. So again, those 2 pieces, the cultural safety and then the appropriate Indigenous data governance. For the process domain, we want to ensure that appropriate processes are in place to uphold and execute cultural safety policies or strategies. And then again, the second piece is related to data governance. So ensuring that data governance processes are in place to guide all the things I just talked about under the policy domain. For the partnerships indicators, there's 3 measurement concepts. So first of all, we want to determine whether relationships with Indigenous communities are in place. Secondly, we want to ensure that meaningful engagement is taking place. So having a relationship, knowing someone within an Indigenous community is very helpful at times. But again, we want to make sure that there's ongoing opportunities to provide feedback and to communicate with communities. And then the third piece under the partnership domain is to ensure that data sharing agreements are in place with partners who collect, store, use, and/or manage data that belong to Indigenous persons. And again, that takes it one step further. So first, the existence of a relationship. Secondly, ensuring that there's meaningful engagement. And then third, formalizing that and having clear expectations of all the partners involved. And then, of course, our personal experiences domain. So here, the indicators that we choose, we want to make sure that they are ensuring that Indigenous persons feel safe and respected while they're receiving care. We also want to make sure that the indicators are ensuring that Indigenous persons are feeling confident sharing their information, disclosing Indigenous status, for example, while they're receiving care, because it speaks to how safe they feel with sharing that information. And then the third piece under personal experiences is it really has to do with providers. So when we talk about personal experiences, we know that our providers are the backbone of our organizations. We want to make sure that our providers are feeling very confident in their ability to provide culturally safe care, that they have the resources available to them to do that. And so we don't want to forget that very important piece of the personal experience indicator domains. So I mentioned you will be placed now into one of 4 groups that will be discussing one of the 4 Ps. Each group is going to be facilitated by one of the team members who's introduced themselves on this webinar so far. You're going to be asked to come to a consensus about a given list of indicators. What we want to know is whether you feel they should be indicated in our data governance indicator framework. So we're going to give you a list of guiding questions. We're going to give you a list of principles and then have a group discussion. The other piece is that while we're having this group discussion, we also want to invite your individual feedback about the indicators. So we've developed an online survey that each participant can take as you're participating in discussions or afterwards. We are going to leave these surveys open until the end of the day so that you're not feeling too rushed in case the conversation in the rooms gets very involved and interesting. We don't want to have to break that. So, but we would like to hear from you and your thoughts and your feedback as well about the indicators and about this work in general. So wanted to give you a heads up about that. And I wondered if we have a couple of minutes here, if before you head into your breakout rooms, whether you have any questions on anything I've talked about so far. We are going to provide 35 minutes for the breakout room discussions and then come back to this main room and talk about our conversations, debrief each other.
Okay, so we'll be opening the breakout rooms now, and as Kristen said, after 35 minutes, everyone will be added back to this main room where we can discuss what we discussed in the breakout rooms. We also just wanted to point out that we will not be recording the breakout rooms, so everyone is comfortable to feel free to share your feedback on each of the indicators, and it won't be recorded, but the moderators will be just taking notes for meeting minute purposes. So maybe we can start with the feedback sharing. So there was 4 breakout groups. There was policy, process, partnerships, and personal experiences. So does any moderator want to volunteer for kind of sharing what was discussed in your group, if the indicators were the feedback, and if there was any changes recommended?
I can start.
Yep, thank you, Kristen.
All right, see, I'm freezing a little. I hope that doesn't continue. But so we talked about the policy indicators. The stakeholders in my group, so the participants rather, were all from meso level organizations. So it was a really, really interesting discussion. So the indicators we chatted about were, does your organization have an Indigenous cultural safety strategy in place? The proportion of policies where Indigenous cultural safety lens has been applied, the number of cultural safety and anti-racism policies in place, and then the proportion of organizations with a strategic plan that addresses Indigenous cultural safety. I think we all agreed that they were all important indicators. They would tell us information that would be relevant about the organizations reporting them. It would be new information. I think overall the indicator criteria, specific, observable, measurable, were met. One important piece of feedback that we discussed was the language surrounding the indicators and making sure that it's not colonialized in any way. So to decolonize the indicator language itself, to state things in really clear terms. I think the participants in our room were really eager to see the specifications for the indicators, to see what we would be trying to measure and how that would help organizations move along in their journey. And then we had a couple of really interesting conversations about data sources as well. Particularly, so of course we'd have to ask organizations to provide the information, but that there are service agreements in place with Ontario Health, and for the upcoming year, organizations who receive funding will be asked to report back on their Indigenous health plans. So that includes things like their cultural safety plans and possibly Indigenous data governance. We weren't quite sure. But there could be potential sources of data for our indicators. And we didn't get to the 5th indicator, but it was a really great discussion. And thank you for the opportunity to report back. I'm happy to answer any questions too, but I know we're tight for time.
Thank you, Kristen. I can go next. So my breakout room was the partnerships indicators breakout room. So the indicators that we discussed were the % of Indigenous communities represented by client population with relationships in place, % of Indigenous representation on the governing board. As a supplementary indicator for that, the retention rate of Indigenous representation on a governing board. And then lastly, the % of Indigenous communities represented by client population for which data sharing agreements, DSAs, were in place. So kind of some similarities with Kristen's room. From the first indicator, we discussed wording and language. So we used client a lot in the indicator language, and a point was brought up that a member of our breakout room, their organization uses citizens, and how we kind of want to be a bit more mindful of the wording that we use. So IPHCC has a lot of member sites, so we shared that we kind of selected some kind of wording that member sites most frequently use, but definitely it'd be important to have some sort of definitions for even words like communities, clients, and what kind of that specifically means. We also talked about the clarity of the wording. So we all agreed towards the end that the rationale for each of these indicators was good and well-meaning, that a lot of them addressed the inclusion criteria. However, that some of these indicators wording is just not intuitive when you first read it. So just to make sure that they're universally understood across the broad spectrum of organizations that might be implementing them, we might want to clarify the wording a bit. So I think like technical specifications will really help with that, as well as just little tweaks like when we're using percentage of Indigenous communities versus numbers, and what would kind of be more easily capturable for the organizations that are reporting on these indicators. And then for one of the indicators, the retention rate of Indigenous representation on governing board, we discussed how we could change this indicator to be a bit more measurable. So what's like the yardstick of retention rate? Do we want to put a specific time period on it? Or do we want to use wording like completion of term, since a lot of organizations do have their own specific governance committee terms, whether that's 1 year, 2 year. And then also where we're talking about the supplementary resources that are being developed as part of this project, the policy handbooks. So for instance, if there is an Indigenous representation on governing board individual or individuals that do not complete their term, maybe in the policy handbook we can go into more details on kind of like a process for that, what's like the exit interview like, how to meaningfully capture feedback to ensure that it informs like better representation or creating a safer governance space for future Indigenous representation. So also just looking into how these indicators can be more built on and developed and addressed in the policy handbooks pieces of this project as well. But overall, I think it was a very meaningful discussion. We had a mix of people in the breakout room who were at the meso level as well as micro level. So an important point that was also discussed, just to close off my feedback, was how to really consider there's some indicators that might be easily captured or responded to by micro level indicators, but when you scale that to the provincial or federal level, we need to be mindful of how easily gathered is this data. Do we need to kind of change some of the wording for indicators for the system level organizations, where it would just be like a very time intensive task to respond accurately and meaningfully to these indicators. So yeah, thank you so much for everyone in the breakout room for their contributions. And that was the partnership indicators feedback. So remaining, we have the process indicators breakout group and the personal experiences. So Sean and Rachel, whoever wants to share next.
I don't mind sharing next. So I was supporting the personal experiences indicator group, and we had a really great and fruitful discussion that went a little bit longer, but it was just so great. So I think one of the things that we really started off by discussing was who defines what safety is, and how are we determining that? Are we determining that from the organizational level, or from the patient, or the person who's the individual who's receiving care, or the provider? So keeping that in mind in terms of who's defining that, and maybe reflecting on that a little bit further, and looking at if safety itself, or defining that, is comprehensive enough. And sorry, I have like, I'm old school, I do handwritten notes. And then also looking at the fact that there could be a lot of vulnerability and hesitancy from asking the individual who's receiving care if they felt safe, especially if there is potentially power differentials between the individuals who are potentially providing that care and then receiving care, and what implications that could possibly have for that individual receiving care, not even during their initial stay, but the rest of their healing journey as well. So we discussed a little bit about the possibility of how to maintain that safety, especially through anonymous surveys or ways that we're able to really collect that authentic experience that an individual had. And then in terms of the indicators themselves, so for the first indicators, so indicators 1 to 3, so really those ones looked at the number of Indigenous clients who reported experiencing racism in healthcare interactions, the percentage of Indigenous clients who felt comfortable asking questions or are expressing concerns to their healthcare provider, and the percentage of Indigenous clients who felt that the organization respects Indigenous peoples and their cultures and traditions. We felt that all 3 of these indicators were strongly recommended, but for all of the data and the indicators as a whole, we thought that there needs to be a purpose and a responsibility to do something with that data that is being collected. And then with indicators 4 and 5, which looked at the percentage of Indigenous clients who felt comfortable identifying as an Indigenous person, and the percentage of Indigenous clients who felt that their medical information in the healthcare system was confidential. Both of these we put as recommended to strongly recommended. And then for indicator number 6, these were looking at the percentage of staff reporting good or excellent level of knowledge in cultural safety, and the percentage of facilities or organizations where staff report sufficient levels of knowledge of cultural safety. So this one we probably would have wanted to have a little bit of a longer discussion on, in terms of who is doing the reporting, if it's a self-reflection data collection of the staff member who is I guess stating their level of knowledge, or if it's a supervisor, or if it should be from the patient perspective as well, or the client perspective, and how the organizations would utilize these tools. So yeah, I don't know if I missed anything, Marlon.
That was very good summary. Thanks so much, Rachel.
Thank you, Rachel. So then last but not least, Sean.
Thanks, Rob. I'll be really quick. We discussed the processes, percentage of processes where, percentage of facilities where processes are in place, and they're informed, they're engaged. We had a real mix of recommend, do not recommend, almost equally. There was only one strongly maybe not recommend, and we did have another couple recommended indicators that we could use. The first indicator, sorry, my notes are way over here. The indicator is around, organizational planning processes embeds consideration for Indigenous clients and communities. Basis is it's a system to collect things over time. The issue of the system is maintaining how things are collected and it having enough flexibility moving forward. I've got a lot of notes, so sorry, I'll turn it back over to Kristen and Prab.
Thank you, Sean. So we just wanted to quickly share a slide about the next steps that we have. I also just wanted to share that the meeting recording, which excludes the breakout rooms, and the PDF copy of the slides will be shared with everyone tomorrow. So I know in the breakout groups, we had some group questions to discuss, and there was a QR code for the SurveyMonkey. So as everyone receives a copy of the slides, if you could also just make sure that you can scan the QR code and just put in your individual recommendations as well for your breakout groups indicators. So I'm just going to share my screen now for next steps, which Kristen will be able to share more about.
Thank you, Prab. So in terms of next steps, I did mention earlier, we will be compiling a summary of the discussions from today's session, as well as the slides and a recording. We'll share that back with everybody who registered shortly. Over the summer and throughout the early fall is when we're going to work on completing the indicator framework, starting to develop those policy and procedure templates that I talked about before, and just refining things overall. The IPHCC very much relies on fruitful collaboration and listening in order to do this. So please look out for other opportunities to provide your feedback. Without your feedback, these products aren't as I think tailored as they could be. So we really appreciate you being here and your ongoing contributions to refining this work. In the fall, I talked about the fact that there's going to be a data conference. So it's there that we will talk about those indicator specifications. That seems to have been a recurring theme from the breakout room discussions today, and obtaining your feedback on the policy and procedure handbooks that we'll be developing over the summer. And then we're hoping that at the end of winter 2024, the final data governance toolkit for macro, meso, and micro level stakeholders will be available. So again, lots of engagement planned, lots of iterations of this work will be taking place over the next few months, but wanted to thank you on behalf of the IPHCC for being here today. Your time is very, very appreciated. We know how valuable it is. So thank you, and we hope to see you again soon.
Thank you, everyone. Thanks, Kristen.